So I might make a start now. So I'd like to acknowledge the traditional owners of the land I'm on today, the Wurundjeri people of the Kulin Nation, as well as the traditional owners of the land you are situated on, and acknowledge that Indigenous Australians have been the custodians of the lands and the waterways of Australia for thousands of years. I pay my respects to the elders, past, present, and emerging. So I'll just introduce myself and then hand it over to my co-facilitators to introduce themselves. My name's Simone Schmidt. I'm a qualitative researcher at UniMello, working in digital mental health and also working at the Royal Melbourne Hospital in digital health. So Mahima, handing it over to you.
Thank you. Hi everyone. You may have seen me before. I was in charge of a few questions from the audience, but it's good to formally introduce myself again. My name is Mahima. I'm a core design researcher here within the centre, and I'm also a qualitative researcher.
And hi everyone, my name is Cara Burns. I work in the Centre for Digital Transformation of Health as a program manager. I work in the Collective Impact Incubator, which is a bit of a front door to the centre. So if you're interested in partnering us on a project, or you're just interested to know a little bit more about what we do, feel free to reach out. I'd love to have a chat to you. Thanks very much.
Okay, thanks guys. So in the morning sessions, we had incredible speakers who have all been researching, developing equitable digital health. And in this afternoon session, we'll focus on translation and implementation of digital health into society. So I'm first just going to quickly go through some housekeeping. If you have any questions, please post them in the Q&A panel to the panelists. And please post on social media using the hashtag digital health equity and DT4H. And you can also tag us at DT4Health. And we'll have a short 15-minute break at 2:15 p.m. So now I'd like to introduce the afternoon speakers of session 3. I'll just wait for Cara to take me to the next slide. So our first speaker is Ms. Lorraine Finlay, the Human Rights Commissioner at the Australian Human Rights Commission. She has responsibility for protecting and promoting fundamental rights and freedoms and leads the work of the Commission in areas including modern slavery, asylum seekers and refugees, business and human rights, and technology and human rights. We are very fortunate Lorraine could join us today to speak on how technology can disadvantage certain populations and how to mitigate these biases. So handing it over to you, Lorraine.
Well, thank you so much, and it's a real pleasure to be here today. I might just try to start sharing my screen and hoping this works. Can everybody see that okay?
Yep.
Yes. Brilliant. One of the risks about talking about technology is when you can't get your own technology to work. So I'm glad it seems to have worked this time. I'm really delighted to be here with you all this afternoon, and I'd like to also begin by acknowledging the traditional custodians of the land on which we meet today from my location in Canberra, the Ngunnawal people, and pay my respects to elders past, present and emerging. I'd also like to extend that respect to all Aboriginal and Torres Strait Islander peoples online today. I'd particularly like to thank the Centre for Digital Transformation of Health for inviting me to be part of this event. What I'm really hoping to do this afternoon is to outline some of the risks that disadvantaged people face when engaging with systems that operate using artificial intelligence or AI, with an emphasis on algorithmic bias and some of the problems that can emerge from that. And I'm jumping ahead with my slides already. To do that, I'd like to explore 3 key focus areas. The first being the work of the Australian Human Rights Commission on human rights and technology. The second being the use of algorithms and the risk of bias in AI. And finally, looking at how organisations might approach mitigating algorithmic bias. But before I jump into the content-heavy part of my presentation, I really wanted to acknowledge that it's actually primarily the work of other people that's led to me being here with you this afternoon. I'm relatively new to the role as Human Rights Commissioner, only starting at the end of last year, but the Human Rights Commission has been involved in exploring questions around technology and human rights well before I started in the role, most notably through our Human Rights and Technology project, which was led particularly by my predecessor, Edward Santo. So I wanted to begin by simply acknowledging his leadership in this space and the work that he put into driving this project. The Human Rights and Technology project was a 3-year national initiative conducted by the Australian Human Rights Commission, and it culminated with the release of the final report that you can see on the screen here late last year. The starting point for this report was that technology is absolutely essential in so many aspects of our lives today, but that it needs to be fair. We acknowledge that we're living in a time of unprecedented technological innovation and transformation, and that as a nation, Australia really needs to seize the opportunity to embrace new technologies. But the report also recognises that emerging technologies can pose significant risks to our human rights and may cause significant harm to individuals. The report ultimately presents a roadmap for responsible innovation, allowing us to realise the benefits from new technology while also protecting our human rights. We want Australia to be a leader in innovation, but even more importantly, we need Australia to lead the way in responsible innovation. These are the key messages from the final report. Australians want technology that is safe, fair, and reliable. We need to approach innovation in a way that reflects our liberal democratic values and laws, and we need to ensure that human rights considerations are embedded at every single step along the way. The final report ultimately made 38 separate recommendations. The recommendation included in Chapter 8 specifically dealt with the need for better guidance for both government and non-governmental organisations in relation to the risks of discrimination within the use of AI-informed decision-making. In line with that recommendation, I'd like to speak with you today about the risk that algorithmic bias poses to already disadvantaged groups and discuss our findings on how mitigating possible AI discrimination is possible. I think the starting point for us is that the use of AI offers all sectors, and particularly the healthcare sector and its patients, the promise of better, smarter, and more cost-effective technology and decision-making. It allows large amounts of information to be quickly considered and analysed. However, the increase in the use of AI also comes with a necessary increase in the need for us to scrutinise its use. Now more than ever, organisations must be alert to the risks that attach to the use of AI, including algorithmic bias. And I think this quote from William Gibson really sums up to me the starting point, which is that these risks alone don't make technology good or bad. It really is all about how we use it. Algorithmic bias ultimately is a type of error associated with the use of AI in its decision-making function, which can result in degrees of unfairness all the way up to unlawful discrimination. Algorithmic bias can arise in many ways, and it can obscure or even entrench unfairness and discrimination. The error may lie in the design of the tool or in the data set that's used to train the AI. But regardless of how it arises, algorithmic bias can cause real harm to real people. It's not simply a theoretical problem. It's natural that healthcare providers want to understand patients and their associated health risks in order to provide the best care in a timely manner. Often, this involves the use of AI to assist those in dealing with patients. However, there is a serious risk in employing AI in decision-making where algorithmic bias might lead to misunderstanding your patients, especially where such errors unfairly disadvantage people by reference to their sex, race, age, or other attributes that are protected under Australian discrimination law. Not only can this result in poor health outcomes, but it can expose providers to legal and reputational risks through making unfair or inaccurate decisions, some of which can involve unlawful discrimination. However, even claims of unlawful discrimination pose unique problems for those operating AI decision-making systems. In particular, it can sometimes be really difficult to determine if an individual has been treated differently on the basis of a protected attribute, where there are a combination of variables entered into the AI decision-making system. This can make it nearly impossible to provide reasons for a decision to determine if in fact unlawful discrimination has occurred. And it highlights one of the many issues posed by AI in the discrimination space. Ensuring that AI is understandable and the reasons for decisions are explainable is really important. In implementing digital health equity design, those making use of AI need to be alert to the risks of algorithmic bias. The use of AI has to be fair and lawful, as Australian legislation is designed to protect people from these kinds of harm and to hold organisations accountable. But ensuring the proper operation of AI is important not only to protect organisations from legal claims. It will also improve the health outcomes for all Australians. And it's for those reasons that those designing or using AI must be alert to unjustified differential treatment between groups of patients and take proactive steps to mitigate any algorithmic bias. So how do we do that? A guiding principle is that human rights should be considered at every single stage in developing technology, especially when AI is used in legally significant decision-making. However, scrutiny is especially important during the design phase of AI. The responsible use of AI starts before the system is ever used in a live scenario. It requires rigorous design, continuous testing, and continuous monitoring to ensure that it is not affected by algorithmic bias either at the start or that bias doesn't creep in over time. Thankfully, AI can be designed and modified with positive steps to reduce bias and inequality from being reflected in its outcomes. These steps, taken early in the AI design process, can lead to more effective human rights protections. To avoid possible discrimination, it's important to consider the design of the tool and the data used to train it. Where an algorithm is expressly designed to exclude a group or to give extra weight to a protected attribute, it's likely to disadvantage those people. In the healthcare sector, this is especially relevant where AI may be used to identify health risks on the basis of a person's age or gender. When training the AI, organisations should be particularly cautious where the AI either gives undue weight to a particular data set, relies on a data set that is incomplete, out of date or incorrect, or uses a data set that's affected by selection bias. That is, where the data set is not representative of a population, and so it may ultimately favour one group over another. Where the algorithm is designed in an appropriate way, focus then needs to turn to the data set used to train the AI-informed decision-making system. A data set ultimately is simply a historical data fed into the tool, which it then uses to learn how to make decisions. If a flawed data set is used, it may lead to the AI producing decisions that are unfair or discriminatory. One example that's often cited is a recruitment tool that was found to have learnt to prefer male candidates over female candidates. In that case, the algorithm was trained to identify patterns in job applications received by the company over a 10-year period. As most of the job applicants were male, historically, the system then learned that male applicants were preferable based on the data set it was given, and it generated recommendations for the future workplace accordingly. The learned discrimination then became embedded in the system and translated into future discrimination. It becomes evident in hindsight that where a data set used to train the AI decision-making tool contains a hidden bias, the AI learning may then entrench that discrimination. This could lead to detrimental health outcomes if particular groups are subjected to such bias. There is, thankfully, a growing body of research, although I'd suggest there is still a lot more work to be done, which considers how to mitigate the risks of algorithmic bias. As part of the Commission's work on human rights and technology, we produced a technical paper in 2020, and a picture's up there on the slides, called Using Artificial Intelligence to Make Decisions, Addressing the Problem of Algorithmic Bias. And what we tried to do in this paper is to bring together the technical experts on the one hand, with a deep understanding of AI decision-making and how it operated, and the human rights experts on the other hand, to try to put together a paper that was technically rigorous, but that really made some useful and practical observations about the human rights impacts of particular mitigation approaches. We paired with a number of expert partners to consider and test the issues of bias in a sandbox setting. That is to say, we simulated a typical AI decision-making system and ran 5 different scenarios where bias may arise due to either the dataset, the use of AI itself, societal inequality, or a combination of all of those sources. The simulations considered if bias would arise in each scenario, the nature of that bias, and how it might be addressed. The scenarios were framed around a consumer's interactions with an essential service provider that most people will deal with at some point, and we chose an energy company in this case. The simulations reflected common business practices where AI is used to predict the profitability or creditworthiness of a potential customer. Given my limited time with you today, I won't detail the 5 individual scenarios or simulations, but will instead highlight some of the key takeaways about mitigation strategies. The first tested solution to mitigate bias was to acquire more appropriate data which the AI uses to learn. As I've previously stressed, understanding the potential weaknesses and limitations of the data set is fundamental to avoiding bias. Disadvantaged groups, such as those already facing systemic bias and discrimination, may be disproportionately affected by an AI that's trained on poor data. That's why it's important to obtain additional data points or new types of information about inaccurately or underrepresented people in the dataset. The simulation showed that this largely helped the AI to avoid bias. The next tactic was to pre-process the data. Pre-processing is a mitigation strategy used to edit features in the data set to mask certain information before it's used to train the algorithm. This allows protected information, like gender, to be hidden before the data is then used to train the AI. However, when adopting this strategy, it's imperative to test the effect of hiding a protected attribute. Our simulation showed that simply hiding the protected attribute doesn't necessarily stop that attribute being indirectly considered by the system. Testing may identify that where an attribute, for example, a person's race, is deleted, other features such as suburb, employment, sales history, and so on, potentially act as proxy variables for that deleted feature. In this way, the AI may still incorporate bias via the use of a proxy variable. This highlights the serious need for rigorous testing of a system before it goes live whenever pre-processing a data set. We then considered increasing the model complexity. Simple models can be easier to test, monitor, and interrogate. However, oversimplified models will often be less accurate and may result in the model not identifying differences between groups. This can lead to a model making generalizations that often favour the majority group at the expense of the minority. Again, this exemplifies the need for testing prior to the deployment of AI. Modifying the AI system was also tested. AI systems can be modified to correct for existing inequalities in society, as well as other issues in data sets which cause bias. Modification may involve adjusting the decision logic applied to the prediction, or modifying the mathematical objective of the AI system so that when learning from data sets, it will choose a model that achieves a balance of fairness and accuracy. However, this approach raised similar considerations to those noticed with pre-processing data. Improving one of the fairness measures may inadvertently affect another fairness measure. Additionally, such modification may also result in an AI that doesn't actually reflect data collected from society, adversely impacting the accuracy of its decision making. This mitigation strategy ultimately was not without its drawbacks, and it raises important questions about fairness trade-offs in AI decision making. Finally, we can change the data questions like whether someone would be a profitable user, which is a complex idea in and of itself. It's rarely possible to measure specific elements quantitatively, let alone concepts like profitability. As a result, we typically rely on a data to quantify abstract concepts like profitability, creditworthiness, or job suitability. The degree to which the target is an accurate representation of the true concept that we're interested in may differ across groups. For example, using someone's health history to predict their health needs may be useful for older individuals with a medical record that spans across their lifetime. However, it may disadvantage young people who may have had limited interactions with healthcare services by way of their shorter lives. This difference between groups may result in unfair outcomes. Finding a fairer measure to use as the target variable may help alleviate this. Regardless of which mitigation measure is implemented, mitigation strategies ultimately need to be tailored to the specifics of the system itself, addressing the potential sources of algorithmic bias. There's no one-size-fits-all approach, and there's no easy or straightforward answer to this in the whole. It requires a tailored approach to each particular scenario and situation. Although emphasis is placed on mitigation strategies during the design phase, AI systems need to be constantly monitored throughout their life cycles to ensure that bias doesn't inadvertently arise. Using AI responsibly and ethically extends beyond merely ensuring legal compliance, as organisations in the healthcare sector should seriously consider the potential downsides of its incorrect use. This is especially important as it's becoming increasingly apparent that people of a lower socioeconomic status, that is, people who are already in positions of disadvantage and vulnerability, are often disproportionately impacted by algorithmic bias. Our work ultimately on human rights and artificial intelligence emphasises the greater need for awareness and scrutiny in all stages, from design to implementation and continuous monitoring of AI systems. Organisations in the healthcare sector should be especially aware of the adverse impacts algorithmic bias can have on health outcomes, especially for disadvantaged people in society. There's a strong imperative to identify and address algorithmic bias, especially where unfairness disproportionately affects people who already experience disadvantage and vulnerability in their lives. I hope the talk that I've just given provides you with some insight into the work the Commission has done regarding human rights and AI, allowed you to identify the risks of algorithmic bias, and provided you with some guidance on how to mitigate these risks. In my view, there is a lot more work that we need to do in this area to ensure that we match the technical capabilities with the practical impacts that they have on people's lives. And given that, as I've identified in this talk, this is an issue that has a particular impact on people who are already disadvantaged and vulnerable, it's something that is really important to consider, not just in terms of legal compliance, but in view of the underlying moral imperative of ensuring that our use of technology is fair to everybody around Australia, to ensure not only the best health outcomes, but the strongest possible protection for individual human rights. Thank you so much.
Yeah, bless you. Thanks, Lorraine. Hopefully everyone can hear me. We've just changed the setting in the room. Thank you. That was fantastic. We're getting some really good comments and love hearts and from the audience. That's great. Thank you. I'll read out one question. It's a deep question, so I'll read it out, but feel free to refer to the Q&A yourself as well. So this attendee is asking that this whole area worries them enormously. In a world of capacity constraints, prioritization, and even rationing may become necessary. So if social inequality does make someone high risk for surgery, so for instance, through smoking, comorbidities, or poor nutrition, do we take their high risk status as is, or do we mitigate according to their circumstances? Do you have any reflections on that?
Look, that's a really important question and something that we see coming up across the board when we think about healthcare. I straight away started thinking of when the pandemic first emerged, and there were conversations amongst medical professionals about, well, how do we prioritise limited intensive care provision if we are dealt with a pandemic that's affecting a whole range of people? And they're really hard conversations to have. What I would say is that in Australia, certainly our starting point, and something that I think is a real foundation for our country, is healthcare should be available to everybody. And we don't want to be in a position where we're having to make those types of decisions about limiting healthcare to people based upon factors like that. So I think if our starting point is healthcare should be available to all, that provides a really good foundation for us then to think about how we make decisions about resourcing healthcare, and also how we can best use technology to hopefully help make it available as widely as possible. So again, those types of decisions don't need to be made.
Thank you. We have a couple of comments as well. One attendee has said this is gold. Another attendee is saying really valuable, and AI decision support tools are already embedded in many health-related systems, and they're not always reviewed by regulatory authorities prior to deployment. So that's, I think you covered that briefly in your presentation. I do have one question from the audience and one from our team here. So I'll go with the audience question first. Richard is asking, how do you organize checks and balances, and at what levels and stages?
Yeah, it's again a really good question, and part of the practical, side of things. So how do you actually deliver this in practice? And I think the most important thing is checks and balances need to be organised at every level and every stage. So it needs to not only be in the initial design of the AI system, but then periodically during its usage to ensure that you don't get unexpected biases creeping in, or the system operating in a way that's unexpected. So it is something that's important to embed throughout. And one of the recommendations we made in the final report was that all businesses should actually start thinking about human rights impact assessments, and actually making human rights something that you don't just think about at the very end when there's a legal problem, but it's something that just becomes embedded in every conversation that you're having. And it doesn't mean having a conversation based around UN treaties and conventions. It really means just thinking about, when we take these steps, what is the impact going to be on the people that we're dealing with and the patients that we're treating? So one of the things we'd really encourage in relation to the use of technology is to make sure that human rights simply become a part of that conversation, because at the end of the day, technology is about trying to make our lives better, and it shouldn't be creating additional human rights concerns and risks in the way that we use it.
Yeah, very true. And I think this is a good segue into a question that our team here had as well. We are keen to hear more about the work in more sort of broader terms that the Human Rights Commission is doing. So other than algorithmic bias, what are some of your other key priorities in the area of digital health equity?
So in terms of technology and human rights, and I might tackle this from two perspectives, one looking at health broadly and one looking at the technology side. In terms of technology and human rights, we're really following up on the report and trying to make sure that it doesn't become a report that was written after years of consultation and expert input and collaboration, and then it goes and sits in a drawer and nothing ever happens to it. We're wanting to make sure that the recommendations are picked up and implemented. And so that's really the focus of our work over the coming months and years. From a health perspective, we think there are some really important human rights issues, obviously, that continue to arise, not only through technology, but, you know, to give just one example, the recent pandemic and the impact that has on the delivery of health services and a whole range of issues around the health of Australians is really significant. And one of the things we have noticed is there's been a lot of talk about, you know, getting through the pandemic and how we're emerging from it. But we think there's a real need and opportunity to look back and reflect on what we've learnt from the last 2 years, both in terms of the things that Australia did really well, but also the things that we could do better, with a view to knowing that there are going to be pandemics and emergencies again in the future. And we need to make sure that we're in the best possible position to actually respond appropriately to those. And from our perspective, part of that is making sure that human rights are a core part of the conversation. Because I think when you're talking about a society responding to a health emergency, the immediate health outcomes are obviously a critical component of that, but there are also longer term health and human rights issues that are equally important to consider. And so we see digital health equity as being something that's an important part of that conversation.
Thank you. Very insightful. Yeah, on behalf of our centre and indeed the audience, I want to thank you for your time once again. That was really invaluable.
Thank you so much for having me.